Here again is the number for the Georgia Department of Health Public Health Hotline. That number is 844-442-2681. Again, 844-442-2681. If you have any symptoms and you think you might have the coronavirus, you're asked to call this number first before you go to a doctor's office. And welcome back to the governor's statewide town hall, where we are hearing from the state leaders about Georgia's coronavirus response. We're now joined by Sean Gables of WGCL-TV. Sean will be speaking with the director of the Georgia Emergency Management and Homeland Security Agency, Homer Bryson. Sean?
Jovita, thank you. And on behalf of CBS 46, along with myself and my corporate family, we are exercising social distancing. So, Director Bryson, I will be asking you these questions from inside my own home. You have helped Georgians recover from hurricanes and tornadoes for 3 years as head of emergencies and Homeland Security. How is the coronavirus pandemic different from those natural disasters, and how is it the same?
Well, that's a really great question, and the principles of emergency management are really the same. And we have a great playbook in our state, and we're following that. We've got 15 state partners in our Emergency Operations Center with us. Of course, our primary partner at the state level is Department of Public Health, which is rather unique. That's different for us, but principles and processes are the same. We get in the partners that we need at the state level, the federal level, the local level, the private partners. We identify what the issue is, and then we focus on what we do to address those issues. We've identified a number of different areas that are of primary importance to us with this particular incident. You heard the governor speak earlier about the testing sites. We're coordinating and managing those 23 test sites. We're finding isolation rooms for people that have the virus but aren't sick enough to be in a hospital and don't have a home environment to go to because of elderly relatives, whatever the case may be. We're looking for, as the mayor mentioned, we're looking at additional bed space for the hospitals, both inside existing facilities, and we're also looking with private vendors and the Corps of Engineers at options to build space if we do need that. We were looking at, a lot has been said about the personal protective equipment and the ventilators, and we've made a lot of progress in the last week and been able to find that equipment and push it out to our medical health providers and our first responders. Great progress. We're not where we need to be. Next week, I expect we'll be in a lot better position with that, but that is certainly one of the big challenges that we're working on.
Director Bryson, we've discussed the capacity and the IC units in hospitals across Metro Atlanta, the food shortages, residents not obeying social distancing. What are the worst case scenarios that you foresee, and what could be the best case?
Well, we're going to leave the worst case scenarios to the medical professionals. They're the experts, and we will lean on them for that, and we'll be listening to them for scenarios, and so we'll be planning based on those scenarios. Earlier you mentioned what's different with this, with a hurricane or with a tornado. Here's what's really different. A hurricane or a tornado is coming. There is absolutely nothing that we can do to stop that or prevent it. This is completely different. It's in the citizens' hands of this state. If people will just listen to what their local governments are telling them, listen to the Department of Public Health, listen to the CDC guidelines, separate ourselves from one another, isolate, be cautious when we're out, then we don't have that big an event. So the uniqueness with this is the ability of the citizens in our state to control how big an issue this truly is and how quickly we can recover and get back to normal.
Director Bryson, we have less than 45 seconds left. I want to get this in. What are the contingency plans to protect Georgians in case a significant number of our first responders get COVID-19 and can't respond to emergencies because they are sick?
The CDC has put in place some guidelines relative to that. We've set up some isolation sites where we can quarantine medical and first responders through the cycle to get them back to work as quickly as we can. We're working diligently hours and hours every day to find the personal protective equipment that they need to do their jobs and be safe and not get sick.
Director Homer Bryson, we certainly appreciate your time with the emergencies and Homeland Security. Jovita, back to you.
Sean, thank you. Tonight, we're also partnering with Univision Atlanta and Telemundo Atlanta. The stations are working to keep all of our Spanish-speaking neighbors and fellow Georgians informed of this critical information. Joining us now, Univision Atlanta anchor Giancarlo Cifuentes is in our newsroom. Giancarlo?
Thanks, Jovita. I spoke with General John Skins, Georgia's insurance commissioner, via Skype. General King is bilingual, so I asked him the questions in Spanish and in English. I first asked him about people who are uninsured and afraid of getting tested because of medical bills. Primero le pregunté al General King acerca de los residentes de Georgia que no tienen un seguro médico y que temen hacerse la prueba del coronavirus y luego terminar con facturas médicas.
Absolutely unfounded fear there. We want people to be screened, but they need to be screened by a doctor. And they can call a doctor and get screened. And if a medical professional decides that it is wise to have those persons tested, the testing will be done free of charge. The Georgia Department of Public Health has got a very, very comprehensive method of doing this, and they have the instructions in Spanish on their hotline.
¿Y en español?
Oh, there's no, está completamente, el miedo que tiene la comunidad no está fundido en la verdad. Queremos que la gente hable con doctores antes de que vayan a las oficinas del doctor. Pero si el doctor decide que es necesario tomar el examen para verificar si uno tiene el COVID, que lo hagan, que no se preocupen, eso va a ser completamente gratis. El Departamento de Salud Pública ha licenciado todo esto y ha organizado este proceso.
Y una pregunta más, we're getting concerns of a lot of calls and messages of viewers that are being worried about being evicted from their homes because they lost their jobs and the landlords are still demanding their rents to be paid. Is this issue being tackled? Will there be a leniency for these renters? Estamos recibiendo muchas llamadas y mensajes de televidentes preocupados de ser desalojados de sus hogares porque perdieron su trabajo y los arrendadores están exigiendo que se pague la renta. ¿Va a haber algún tipo de flexibilidad para esto? ¿Se está analizando esta preocupación?
I know that local leaders, both mayors and county commissioners and leaders in the local communities, are engaged in the governor's office, and that is one of the things that is being figured out and how to approach that very carefully. Clearly, there's a role where the state government takes the lead, but in many of these situations, obviously the state government has to defer to the local control. It's been incredibly important that we respect the authority of our local leaders to make those kind of decisions. And these are all very hard decisions to make. Nobody is minimizing the challenge that we have.
¿Y en español, por favor?
En esto lo que estamos haciendo, estamos teniendo una conversación muy seria con los líderes locales, los alcaldes y los comisionados de los condados para tener esta conversación. La oficina del gobernador, él entiende que tiene que cooperar y tener una cooperación muy, muy junta con los líderes locales, porque esta cuestión y muchas otras cuestiones de este tipo están siendo consideradas, pero no ha habido una decisión ahorita, que lo están estudiando el problema y cómo vamos a poder ayudar a la comunidad.
Thank you for your time, General King. Gracias por su tiempo.
Muchísimas gracias, aquí estamos para servirles.
And now we are joined by Governor Brian Kemp. Governor, good evening.
Good evening.
My first question, the emergency phone line for COVID-19, right now it's only giving information in English. Is there a place to offer this information for Georgian residents that may not be able to benefit from this information?
I think probably the best thing to do would be people to go to the Department of Public Health's website. If that becomes an issue, we can certainly work with all Georgians. I mean, look, we want people to be educated. We have a lot of different resources. They also can go to their county health department, which is a great resource. As you can imagine, we have a lot of people calling the statewide hotline. On some days, it may actually be a little easier to go to the county. We have actually added workforce to the call center hotline to keep up with the volume. And look, that's what we want. We want people to get information so that we can share with them best practices what they need to do, if they feel like they need to be tested. And that is really part of our message tonight, and why we're so thankful that this event is taking place, so we can tell Georgians, if you feel like you're getting sick, if you're showing the symptoms of the flu, coronavirus, whatever it is, call your public health department, call our hotline number, call your doctor, ask for advice before you leave the house. The last thing we want people to do is to be sick and be transmitting this disease by going to a doctor's office waiting room, a hospital waiting room, or maybe saying, I'll get over it tomorrow, I got to run to the grocery store. This is not the time to be doing that. We need people to stay at home if they're sick and get that medical advice. And one of the ways that we stop the surge at the hospital is for people never to have to go there to start with. And if people will stay home, most Georgians are going to have very mild symptoms. They can get over this in a couple of days, and there's no need for hospitalization. Obviously, if you start feeling bad, you need to call your doctor or call 911. But that is part of our goal, is to educate Georgians, so we want to communicate in every way possible.
Governor, and are there any state programs that may assist Georgia residents that do not qualify for Medicaid due to the lack of proper documentation to cover those treatments for coronavirus?
Well, I can tell you, and from my discussions with our public health officials, with folks at the national and the federal level, no matter who the person is, if they're in our state and they're in our country, we've got to make sure that they get treated and that they don't continue to spread this virus. Whether it's through Medicaid, Medicare, the indigent population funding, which I know is part of the stimulus, one of the stimulus packages. The President and the Vice President have both spoken to that. Anybody that needs a test will be eligible to get one at no cost, and certainly the same as for treatment. This is vital that we stop the spread. As Dr. Toomey continues to say, we need people to do the right thing here. Georgians will be the solution to this.
Thank you, Governor Kemp. Jovita, back to you.
And thank you, Giancarlo. Tonight, we're also partnering with Georgia Public Broadcasting, which broadcasts across the state, as you know. GPB anchor Patricia Murphy is here also in our newsroom with questions for the governor. Patricia.
Thank you, Jovita, and thank you, Governor. Governor, earlier today, you ordered that Georgia schools remain closed through April 24th. What new information did you have that led to that decision? And will Georgia students be expected to meet state standards in the fall if they can't return to school this spring?
Well, I did make that decision today, and like every decision I've made since we started dealing with this issue, I've been leaning on a lot of professionals, whether it's in public health, whether it's in public safety from a response standpoint with GEMA, General King's Preparedness Committee, Mayor Bottoms on the homeless and displaced population, Dr. Ben Watson, who's a state senator, who's on our physicians task force communicating with the medical community all over the state, our hospitals, you name it, faith leaders, and we're doing the same with our school leaders from across the state. I've had some great calls with a group of very diverse school superintendents that represent metro, urban, suburban, rural areas across our state to ask them their thoughts on when could you think you could go back, what is ideal for them, kind of measuring where people's spring breaks are for systems, and they're different, but they're fairly close, measuring those type things, and then looking at what the end of the school year looks like if the kids can come back, if this virus gets shut down by the people of the great state of Georgia. And really after all that conversations, there's a lot of different thoughts. The school districts are much like our cities across the state. Atlanta's certainly different from Dublin or from, Homerville. And after talking with them, I really came up with this decision because I felt like it gives us enough time to really see where the virus is going to go. I think one of the things that Dr. Toomey and I have talked about so much is the data that we're seeing today is 2 weeks old. The data that we're going to see 2 weeks from now is going to be what really happened today, and that's just the nature of this. We've seen it in China, South Korea, Italy, and we're certainly seeing it in other parts of the country and across the United States today. And I just felt like that gives us enough time where we're not moving too fast. We got to have some lead time for our school leaders to be able to ramp up, get the teachers back in a few days before the students. And I just felt like the date we set would allow us to do that, and hopefully we're on the backside of this virus. We want parents to be comfortable sending their children back to kids. We want our teachers that are going to be working in that environment and our administrators to be comfortable that they can go into that environment and they're not going to be adversely affected by the coronavirus. And that's what really led me to the decision today.
All right, and do you have any insight into the state standards that students may still be expected to meet if they're not going back to school in the spring?
Yeah, I think, these decisions have all been made along with our state school superintendent, Richard Woods. I appreciate his work, the state school board, all the local boards and local leaders that have weighed in. Superintendent Woods has taken some action in regards to our school. We have signed executive orders to do a lot of different things to deal with this crisis, whether it's the Department of Labor and unemployment insurance claims and other things. But Superintendent Woods has taken action on that, and I think it was the right move at the right time. This is unprecedented. Our state's never had to deal with something like this, but I can promise the citizens and the kids of our state that we're going to continue to collaborate, not only with state leaders, but with our local partners to see how we address this and make sure that our kids are doing everything that they can between now and the summer break. And I want to applaud our educators for what they're doing with distance learning and how hard our bus drivers and lunchroom workers and all the folks at the local level, how hard they're working to get meals out to kids, because many kids are not getting meals if they're not getting them from school. And there is some great work going on across our state with those folks.
And Governor, earlier today we learned that state uninsurance claims have doubled just in the last week alone. So many people, when they lose their job, they also lose their health insurance. Do you have any plans to expand Medicaid to help those Georgians who lose their health insurance continue to have coverage while they're out of work during this crisis?
Well, the whole Medicaid argument would be a legislative question. Obviously, with the legislature suspended, that is not an issue that I've been focused on. I think the good thing is the nation's governors, and I was on a call today with the president, the vice president, many members of the task force, Secretary Mnuchin. I talked to Secretary Esper today. I talked to Secretary Azar a couple of other days. It is unprecedented, the level of communication that we're having with the toppest layers of government all the way up to the president. They have been listening in a bipartisan way to the nation's governors about what we need to deal with this healthcare crisis that we all have going on in our states, many of us in different phases. I'm in a very different phase than Governor Cuomo in New York or Governor Newsom out in California. But we all know that we're going to see more cases. We're going to have hot spots like we have in our state that we're dealing with, and we got great teams that are on the ground doing that. But I just think that they've accounted for a lot of that. There's billions of dollars in the budget for our hospitals. There's billions of dollars for the states. And this is one of the things I actually spoke directly to the president about in the call before today's call, and asked that they give block grant money to the states so we could put that money where we need it. Nobody knows where to do that more than the nation's governors do, because we're on the front lines of this crisis. And Georgians can know that we continue to work with the state appropriations chairman and the legislative leaders, Speaker Ralston, Lieutenant Governor Duncan, and many other people to make sure that we're looking at those issues and that we have the ability to be flexible to pay for our Medicaid program and take care of all Georgians during this crisis. And I want to again thank all those on the front lines of the healthcare battlefield, our doctors and nurses and EMTs and lab technicians, and just everyone that's working so hard to fight this virus.
Well, thank you, Governor Kemp, for your time. We now join Russ Spencer with WAGA TV. Russ, I know your team has also been reaching out to viewers for their questions for the governor as well.
Patricia, thank you very much. And Governor, thank you for doing this. Yes, we certainly have. And the overwhelming number of questions, Governor, have been specifically about this question of a statewide lockdown. I know you've answered it before, but what do you say to Seal in Woodstock, who says, my husband has a compromised immune system, as do many fellow Georgians, and not taking this stance immediately is irresponsible of our governor, who I voted for. What do you say to Seal and to those who are watching tonight who think that the media and Democrats are blowing this out of proportion?
Well, I have great appreciation. I've heard obviously from a lot of Georgians. I continue to do that. That's one reason part of the order I had on Monday was to focus to that most at-risk population, those 65 and older, the medically fragile. It is up to all Georgians, including myself. I've done this with my own mother, telling her, you need to stay at home, don't go out. It would be, just not a good thing to do. By her staying at home and other elderly or medically fragile folks staying at home, it will lessen the burden on our hospitals, especially our ICUs, the number of ventilators that we need. It's basically, equipment prevention that we would need in the future if we can keep people, especially that population, out of the hospital. They are adversely affected. But I'm also having to balance that with, in Jeff Davis County, I know of 2 days ago, they didn't even have a single case down there, and you have people saying, look, we need to be working. I'm worried about losing my home. I'm worried about getting meals for my kids. And so those are the kind of things that we're balancing, but all of this is to focus on the public health of our citizens. And the things that I knew that we needed to do from a statewide perspective on Monday was protecting the medically fragile and the elderly, making sure that we were closing down bars and nightclubs. I think I may have said restaurants earlier and I misspoke, but it was bars and nightclubs because that's where we had large groups of people gathering, and then also making sure that we're not having large events in our state. Over 10 people, you've got to socially distance. If you can't do that, you do not need to hold any kind of large event. And I know that's tough in the faith community. I wrestled with that very much, but our faith leaders, who I was on a call this week with almost 800 faith leaders across our state, making sure that they knew how serious this is. Dr. Toomey spoke to them as well. I asked them to do online services. There's some creative pastors out there that are doing, people used to go to the drive-in theater. Now people are going to drive-in church. They're staying in their cars, still holding the services, but they're practicing the social distancing. So I think we've targeted the areas that we need to target. If we need to do more in the future, I certainly have that tool still in the toolbox.
All right, Governor, thank you very much. I'll turn it over now to Cheryl Preheim from WXIA. Cheryl?
Thank you. Because of a limited number of testing in our state, Governor, you have said that the priority will be people at risk over 60 years old, our healthcare workers as well. But I have a question from a doctor in Decatur saying, I'm sick, certain I have COVID-19, but I cannot get a test. If I, as a frontline medical worker, can't get a test, how can others? Have you asked the federal government to send Georgia more tests?
Well, Dr. Toomey may want to respond to that. It would be my take on it that individual is absolutely the person that we need to be testing. They should call the hotline or get to Dr. Toomey's office or our office, and we will talk to them about getting that done. I know there's been a high level of frustration with testing, including with myself and with our task force, and I promise the people of this state, we are doing everything in our power to ramp up testing. You can see that we have through our numbers with 23 mobile testing sites right now, and every governor in our country has asked for more testing, and there's some unprecedented things that are going on right now. I believe we've tested in the United States now more than any other country, was what the president was saying today. I said earlier, I talked to somebody earlier today that's really got something neat that we're trying to make happen in our state. I hope we can get that done. But those things continue to wrap up daily. I think Georgians, as they see the cases go up and the number of testing go up, that will be proved to be true. And I don't know if Dr. Toomey has the ability to answer, but she may want to weigh in.
Kimberly's asking, please ask Governor Kemp why he has not yet put a protection from loss of jobs for caregivers of high-risk groups. She says, if I can't go to work, I lose my job. I care for my father who has serious medical conditions. I have 3 children who are home because schools are closed. Yet again, if I don't go to work, then I don't have a job to go back to. A lot of people in very difficult times here, Governor.
Oh, no doubt about it. And look, I am very empathetic to those individuals. I've been a small business person for over 30 years. There's been tough things that I've been through, tough times when I couldn't pay myself and I was paying the hard-working Georgians that work for me because I knew if I didn't do that, they couldn't buy groceries, they couldn't pay their rent. We have an unprecedented amount of people across our country right now that just in a matter of days have had that happen to them. That literally tugs on me every single day, as well as these, really tough decisions that myself and members of the task force are trying to tackle from a healthcare perspective. I can promise you we are doing everything within our power in the state. I've signed executive orders. I've been working hand in hand with our Labor Commissioner, Mark Butler, who's presented some great ideas to us on the unemployment insurance. That is part of the package that we have talked to the President and the Vice President about. It's part of the stimulus package that I've discussed with our U.S. Senators and Congressional